Hi, everyone. My name is Larissa Nekhlyudov, and I am an internist, primary care provider at the Brigham and Women's Hospital, and I'm also a cancer survivorship physician at the Dana-Farber Cancer Institute. A topic that I've been asked to talk to you today is, I have cancer, why do I need a primary care provider? And I'm bringing this to you as both a primary care provider and also a cancer survivorship physician. Primary care providers play an important role in caring for patients across the cancer care continuum. First, at prevention at risk reduction. Primary care providers are key in counseling patients on tobacco, diet, sun exposure, physical activity, alcohol use. We also counsel patients often on medications such as aspirin and provide immunizations. Cancer screening is one of the key roles that primary care providers have. We pay attention to age and gender-specific recommendations and make that our patients undergo the cancer screening that they're indicated for. And we also take family history and often refer patients for genetic counseling and testing. Most cancer diagnoses are actually made in primary care settings. And this is where often the primary care provider is interacting with other healthcare providers, getting biopsy results, pathology results, working with a lot of specialists in order to get at a timely diagnosis. Primary care role during cancer treatment is variable, as patients often transition mainly into the cancer settings. And then patients go into survivorship. Now, survivorship is a phase that is often referred to for patients who have completed treatment, but oftentimes it's not, and it's for patients really from the time of diagnosis to the time of death. And as demonstrated in this figure, sometimes the pathway is linear. The patient goes from diagnosis to treatment to survivorship. But oftentimes, survivorship then leads to additional treatment or continuation of treatment for many cancers now, and then may then proceed to an additional cancer diagnosis, and the pathway may start all over again. Primary care physicians also play an important role in end-of-life care and may help patients to implement advanced care decisions, hospice care, and bereavement care. And really across the entire spectrum, from the time of diagnosis through treatment, survivorship, and end-of-life care, primary care physicians have a role in planning, palliative care or supportive care, providing psychosocial support, monitoring and preventing long-term and late effects, and family caregiver support. And I will walk you through this a little bit more. So let's talk about the role for the primary care provider at the various phases of the cancer care continuum. So at the time of cancer diagnosis, the PCP role is critical in explaining the diagnosis. And of course, in explaining the diagnosis, there needs to be awareness of what are the limitations that the primary care provider has in his or her knowledge about the diagnosis. And probably best to leave prognosis to the specialists. The primary care provider can also offer and expedite referrals to appropriate specialists, and also taking into account patient preferences. So oftentimes the primary care physician will know the patient and will know what his or her preferences are for the type of a provider, type of a physician. You know, what are their communication skills? What are they like? What's their bedside manner? And make the appropriate referral. At the diagnosis is also a good time to update vaccinations, because patients will often have to undergo immunosuppressive chemotherapy, and making sure that the patient is updated before they undergo chemotherapy is important. And PCPs have to communicate with specialists, offering insights about patients, again, their preferences, their values, and weighing in on their overall health. These are the providers who know the patients, who have known the patients, and really can provide some important insights. And then what happens at cancer treatment? Again, the PCP can be there to provide logistical support. Again, help with referrals or help with other things that the patients may need. Provide psychosocial support, and that includes psychological support, dealing with depression, anxiety, all the fears that patients may encounter during this tumultuous phase of care. They can also help and assist with providing some financial and insurance counseling, may be available through their healthcare facility. And oftentimes, because they have a relationship with the patient that may be longitudinal and may also know the family, they can provide some support in this sense as well. The PCP can also provide input about treatment decision-making. And oftentimes patients do come to the primary care provider to ask them, well, what do you think? What should I do? And so it's important, again, for the PCP to take into account patient preferences, values, and overall health in guiding them to make these decisions. The PCP can manage non-cancer care, such as diabetes, high blood pressure, and other healthcare conditions. The PCP can provide urgent care, but the important caveat here is always to check in with the oncology providers during treatment, because some of the chemotherapy agents or the newer immunotherapy agents may have some side effects, and it's important to let the oncologist know if your patient is presenting with unusual symptoms. And just like in the other phase, the importance of communicating with specialists. So now I'm going to go through areas in survivorship care. And so here there are several aspects that are important. So again, this may be a patient who has already completed treatment, but it might be somebody who is on chronic cancer treatment. And so some of the things that a PCP may be involved with is monitoring for recurrences and new cancers. Of course, that probably will be mainly the focus of the oncologist, but the PCP should at least have an awareness of what monitoring is needed, whether it's a mammogram or a colonoscopy or a CAT scan. They might not be ordering any of those tests, but I think that it's important for them to have a general understanding of what's needed. And then, of course, we need to monitor for physical effects. So these are the effects that may develop as a result of cancer or its treatment. And it could range from musculoskeletal issues that come from surgery or from radiation therapy. It might be cardiovascular toxicity that may also develop from chemotherapy or radiation therapy. So having awareness is important for the primary care provider in this phase as well. And just like in the other phase that I mentioned, the psychosocial effects monitoring is also going to be a key piece for the PCP to be involved with during this survivorship phase. So these three up at the top are all really cancer and cancer treatment related aspects of cancer survivorship care. And the important piece not to forget is that we still have to take care of the patient as a whole. So they might have had diabetes or hypertension or lung disease prior to their cancer treatment, and that needs continuous monitoring as well during this phase. And health promotion is still an important piece, monitoring for cardiovascular risk factors, providing vaccinations, screening for other cancers and other conditions is an important piece. And then the role of the PCP at the end of life. So again, just like with the other phases, we need to offer psychosocial support and take in input about and provide input about patient preferences, values, and their overall health. primary care providers really have an important role in referring patients to palliative care and end-of-life care, if not already done. This is an area that has always been sort of an area of contention with oncology care. And in the oncology field, there's really now a growing push to refer patients for palliative care or supportive care early on, and then really get end-of-life consultants involved early. But oftentimes patients don't want to talk about that with their oncology provider because they don't want to give them a sense that they are giving up. And so teasing that out in conversations with primary care is important. PCPs can also help to manage symptoms as needed, and just like with the other phases, communicate with specialists along the way. So that was my assessment for you, taking my role as a primary care physician and a cancer survivorship physician about the role that the primary care provider might have across the cancer care continuum. But I thought that it's really important to take other viewpoints into consideration. And so as a relatively new user of Twitter, I posted this message stating, I've been asked to give a webinar to patients and caregivers. I have cancer, why do I need a primary care provider? Seeking input, especially from patients, advocates, and looking to hear all perspectives. Please retweet. And I was surprised by the level of responses that I got. So quotes and ideas and input came from all over, and it was patients of all ages, patients with all cancer types at various points in their cancer care continuum, as well as primary care providers and oncology providers. And really the input was tremendous. And what you see here is really just a sampling of the comments I got. And so what was the summary of what I learned from these various tweet responses? So there was a whole lot of support for needing a primary care provider. Summarized here is, of course, you need a primary care provider. And so what are some of the arguments that patients made? Well, they said that this is a long-term relationship starting before cancer. And as one person said, you needed a PCP before cancer, you need a PCP after cancer. And so they felt like having the long-term relationship really helps them during the cancer care continuum. Another piece was that the PCP translates information given by the oncologists. So the oncologist may often present information, and then the patient may be there in the exam room and may pretend that they understand what the oncologist said, or might be actually, may kind of tune out what the oncologist is saying. And then oftentimes we'll come to their primary care provider and ask them, can you explain what the oncologist said? What are my options? They also thought that the PCP provides holistic care to the whole person and not just to the cancer. They said that the PCP is readily available for urgent care and for prescriptions, and that with a PCP, they don't need to bother the oncology provider who might have other important things to do. The PCP is often thought of as an important person to provide emotional support, cares for other medical conditions, provides preventive care, and coordinates care. So these were some of the positive aspects. But there were also some concerns and challenges that were voiced by the community. They felt that PCPs often have insufficient knowledge, both of the cancer and the treatment effects, and often might give them wrong information and information that goes contrary to what the oncologist says. That might cause some anxiety among the patients who are getting this information. There were concerns raised about a fragmented healthcare system, which makes communication and coordination an issue. Sort of figuring out what does the PCP know, what does the oncologist know, how do I communicate between the two of them? Am I the person who's supposed to communicate information back and forth? There were some who said that specialists are just better able to handle the issues. They didn't feel that the primary care provider was sufficient in order to handle their cardiac, their gastrointestinal, their endocrine, their gynecological issues. And of course, what's not new is that it's often hard, it's often difficult to find a primary care physician. These are not readily available and may not be available in your network. And if you have a PCP, the PCP may not always be available, and it might be difficult to reach the primary care provider as well. And then, of course, limited primary care provider time. They don't have time with their 5 minutes to take care of my needs. So I wanted to give you some practical strategies here in terms of finding or changing a primary care provider. So one of the important ways that you might pursue this is ask your oncology team or your local survivorship program. So your oncologist has worked with many primary care providers, and they have a general sense of who's good and who's not in terms of providing the needs and taking care of all of the needs that you might have. You know, they might have someone that they have worked with quite a bit and somebody who they think really takes an interest in cancer care. And if your oncology team doesn't have one, there are local survivorship programs that are available. They're not available everywhere, but certainly out there, and that might be another venue. And you don't necessarily even need to go there for an appointment. It might be that you call them and you ask them, you know, who do you typically work with in your area in primary care? And they will let you know. So the other piece obviously is asking family, friends, and also peer support group members, you know, who are the primary care providers that they use? Do they understand cancer care? And would they think that they would be good primary care providers for you? So this is kind of a big point, and I always make this with my patients, is that really ideally, unless absolutely impossible, it's important to have a PCP who's within the same healthcare system and uses the same electronic health record as your oncologist and maybe even your subspecialists. It doesn't necessarily make care extremely easy, but it definitely does help, because the you know, every one of your healthcare providers will be able to see the notes that are written by the other healthcare providers. They will be able to see the imaging results, the CAT scans, the blood work, the echocardiogram, and can weigh in on that. You know, there is really, I was going to say almost, there's nothing worse, but from a physician standpoint, it's true when your patient comes in and says, oh, I had blood work, I had an echo, I had this done at this hospital, and you say, yeah, I have no way of getting records from that hospital, and then you're stuck with you know, getting things faxed to your office. So the other piece is this sort of this concept of oncogeneralists. And so what is an oncogeneralist? So these are basically, I sort of call them, you know, these are the sort of the geriatrics, the geriatricians. analogy, right? So all primary care providers take care of older patients, but there are specialists out there in geriatrics that are kind of very specialized in providing care to older patients. But all the older patients are not going to be able to access geriatric physicians. And so the same kind of holds true with oncogeneralists. So oncogeneralists is sort of a growing, not entirely a specialty, but it's really a growing interest among primary care physicians to become more knowledgeable about oncology. And so they sort of are more interested in caring for patients during cancer treatment and after cancer treatment. But there are very few oncogeneralists around there. And so I think sometimes patients want to have an oncogeneralist, someone who's really in tune with cancer care to take care of them, but they're not available. And my own feeling is that being cared for an oncogeneralist is really best for those with complex cancer treatment. And then really for cancer survivors who have not had really unique cancers or rare cancers or had a lot of chemotherapy, radiation, bone marrow transplant, those patients probably don't need an oncogeneralist. They probably don't need somebody who has particular expertise in cancer. And then so, once you get some names, look them up and then seek an appointment and establish fit. I think that it's important to have that one-on-one meeting and make sure that you're on the same page, because it may be a great doctor, but you just don't have the rapport, you don't have the connection. And so some of the practical strategies with respect to communication and care coordination. So as I alluded to before, so being in the same system and using the same electronic health record definitely helps. The other piece is ask specialists, no matter where you go, to CC, to send the chart, to send the note to the primary care provider. The important piece is make no assumptions. In other words, just because you asked your specialist to carbon copy the primary care provider does not necessarily mean that it happened, and it does not mean that the PCP got the note. So, this is one of the main, issues with our healthcare system. And so oftentimes you do need to just make sure that this communication is happening. And it's totally okay to reach out to your primary and say, I just saw my oncologist. Did you see my lab results? Did you see my CAT scan? And it's fine to do that. But the important piece I think I wanted to stress in this is that just don't make an assumption that something happened. And also, if you see your primary care provider and there's something that you discuss that you think that your oncologist or that your specialists need to know, then ask your primary to send the note to the specialists as well. The use of patient portals. So many of our systems have electronic health records, and they do now more and more include patient portals. So patient portal is basically a way for you to log into your electronic health record and be able to access your notes with the providers, and also lab results and X-ray reports, etc. I am always a fan of patients using patient portals. I think that it's important for patients to be able to see their notes and to read their notes. When doctors know, healthcare providers know that you will be reading your notes, I think it's important also for us to make the notes readable to patients and not just for healthcare providers. So I often encourage my patients to use the patient portal, look at my assessment and plan, why I suggested what I suggested, and then to send me a message on the portal asking me if they have any questions. And the last piece, which is really a critical piece, is maintain regular care with your primary care provider. And that's important to build trust and a relationship. As I mentioned earlier, the primary care provider will often make the diagnosis, and then the patient goes on to be treated by a whole group of oncology providers, and oftentimes the primary care provider falls out of the picture. So even if you're not involved and if you're not seeing the primary care provider, it's okay to reach out to them, just to check in, try to make an appointment to see your primary care provider. Do reach out by patient gateway. And I think it's also important, for the primary care provider to do the same. Oftentimes when our patients are in treatment, we do get those notes from the oncology provider. So reaching out to the patient via the patient gateway or by telephone just to let them know that you're here, and that you're available to help them in any which way, even while they're undergoing treatment, it still does help. And then hopefully when they finish treatment, it builds that relationship and that continuity. So I wanted to now take you to, oh yes, and what I have here is that it's really okay to change the primary care provider. You're not stuck with the same PCP just because. And I think that it's important to realize, when it's time to change. And it might be time to change for a variety of reasons. It might be interpersonal. It might be, to be in the same system as your oncology provider. It may be for a whole slew of different reasons. And I think that it's important for all of us to know that it's okay, and it's not taken personally. So now I just wanted to take you to two quotes that I wanted to highlight from the Twitter chat that I think really summarize so well. So one is from a patient who says, "A knowledgeable PCP is vital to your care during and after treatment. Everyone has a job to do. You are the patient. Oncologist focuses on your care. PCP, what's going on with your heart health, conditions before cancer, toxicities, how you stay healthy, etc." And then this quote is from a primary care provider who commented on what can a patient expect from their primary care provider. And she said, "We can expect the PCP to take comprehensive view of health and values to help patient navigate challenging decisions ahead, partner with their cancer specialists, and you to coordinate and sometimes translate for you to continue to provide longitudinal care before, during, and after." So I hope that with this presentation, it gave you some pause and made you think about your own primary care provider. Do you have one? How often do you communicate with your primary care provider? What role does he or she have in your care? Are you satisfied? Are you not? So as you take a moment to think through that, I just wanted to thank three individuals who really helped me out with the Twitter input. And they are Miriam Lusberg, who is a medical oncologist, Beverly Zavalita, who is a family physician who is also a breast cancer survivor, and Martha Carlson, who is a patient living with metastatic breast cancer. And I also wanted to thank everyone who shared their experiences and provided input on Twitter and allowed me to get a greater perspective on some of the issues that are important for patients with respect to the role of the primary care provider. So thank you again for inviting me to give this webinar to you today. And I hope this helps you in your decision making.